Well, here we are on location at Cherry Health. I'm here with Dr. Lloyd. Thank you so much for having us
Well,
today.
thank you. Thank you for coming.
So this is a legacy business here in Springfield. I mean, you've 20 years of Cherry Health, and so what has been the drive behind your business?
Well, for 20 years, when I met my wife here at the Bass Pro Great Southern, and went to school at SMSU. So as a youth, I wanted to be a chiropractor basically all my life, and went to St. Louis for school, and naturally came back here because of my wife's family, and we just love Springfield. And so our motivation was to basically restore health and keep people off the surgical table and keep people off of medication and restore their function so they're not using medications and surgeries to actually prevent further deterioration. And so right now, a lot of people are treating pain and not problems.
Yeah.
And if we can treat the problem, the pain will go away. But right now in our society, we're treating more of the pain than we are the problem.
Well, I'm glad that you say that because, you know, it seems like you have a holistic approach. And one of the reasons that, you know, I've seen a chiropractor many times, and I always have to go back. And so is that something that you've seen with folks?
And that's one of the number one complaints you hear is like, I have to go back over and over. And the old joke is, how many chiropractors take a screw in a light bulb? The answer is one, but it takes him 12 visits. You know, but the truth be told, it's kind of like a rusty hinge on the screen door. You sell the milk cows, the screen door is going to slowly start rusting up. And so if we go out there and grease that and wiggle it and start restoring its function, it works better. But if you don't go in and out of it consistently, it's going to slowly start rusting back up on you. So you got to keep going back and getting greased and wiggled. Yeah. And our approach is definitely unique in that we have chiropractors and doctors of physical therapy working together. So the chiropractor can grease it, wiggle it, restore that function, but then the doctor of physical therapist can come in and teach you the exercises and all the movements you need to do to go in and out of the screen door to maintain that function long term. Yeah. So we don't try to get you on maintenance care for long periods of time, because we're going to teach you how to maintain it yourself, and you don't have to keep coming back and becoming addicted to the chiropractic care.
So Dr. Lloyd, because you have doctors of chiropractic, you have doctors of physical therapy and doctors of medicine all in one location, does that make it more expensive for people?
No, actually, it's, you know, as a chiropractor, if you just came to me as a chiropractor, the only thing covered, say, by a Medicare patient, the only thing covered in the office would be the adjustment itself. The exam, the x-rays are not covered, you'd have to pay that out of pocket. Any therapies I gave you, that would be out-of-pocket expense too. But in our office, we have a medical doctor. When you come in, you'd be examined by a medical doctor, and your MRIs, x-rays would be ordered, and they'd all be covered under that program. Of course, your adjustments would be covered, and then any physical therapy that you had would be covered under the doctor of physical therapy. So you're really getting 3 times the care for less out of pocket. And it's going to be more intense care, where you have a doctor of physical therapy going through all your biomechanics. You have a doctor of chiropractic doing all your spinal and joint biomechanics. You have a medical doctor evaluating you thoroughly too. So it's actually greater care with less cost.
Well, this all sounds amazing to me, Dr. Lloyd. And so how does someone take the first step?
Well, multiple ways. You can call the number on the screen, access our website, cherryhealthcenter.com, our Facebook. We have a new patient team waiting for your call.
Wonderful. One more time, we're going to put that information up on the screen for you to be able to get a hold of. Thank you so much, Dr.
Well,
Lloyd.
thank you. We appreciate you.